Hi everyone, welcome to our class, the healing reaction class. Again, my name is Stephanie and I'm going to talk about the different reactions that a patient may experience during the process of healing. First of all, most of you are aware of the process of a healing reaction, and it's totally normal. A patient should expect to have these type of symptoms present at some point of their therapy. First of all, we don't know how it's going to be for each patient. It depends on if they're doing their advanced treatments. It depends on their condition, metabolic condition. And some of you will experience these reactions within the first month of doing their therapy, and others, especially patients that had chemotherapy or radiation, may experience these reactions maybe after 5 months of doing the therapy. The intensity may also vary for each patient, the frequency, and the duration. Based on experience, we have come to classify these reactions in three major reactions. The first one is a toxic detoxification or toxic reaction. The second one is the detoxification reaction. And the third one is the healing of inflammations. Now, I'm going to let you know a list of the different symptoms that each reaction may have and what are they related to. And also, I'll give you options of things that you may apply naturally to help ease down these symptoms and let you cruise through them without no issue. But let me say this, it's always important to have a plan when you're having these reactions or when you're preparing yourself to expect these reactions. And by a plan, I mean you have to have a doctor on hand, a first-time call of an emergency if it may occur. You may also have to plan a hospital that you may go to if you feel that the symptoms are not going down. We are with you throughout your program, but it's always difficult to diagnose or to treat when a patient is outside of the clinic. So it's always good to have this on plan. Okay? That being said, I am going to explain to you the toxic reaction, which is the first one that we spoke about. The toxic reaction, their symptoms are more related to the body trying to push toxicity that is be safely kept in our cells for many years. And this toxicity can be from prescribed medications that we've taken before, if we did chemotherapy or radiation, and even pain medications. So our cells have been safely kept all these toxins in their structure, in their inside. So your body, when you're doing a detoxification reaction, may need the extra help on pushing out these toxins. Now, what are the symptoms that a patient can experience in these toxic reaction? First of all, emotional distress. A change in your emotions from happiness to sadness, irritation. You can also experience very heavy migraines. So talking about the symptoms, we already talked about irritation, emotional distress, depression can be also one of the symptoms. What can we do? The first line of defense on this type of reaction is adding more enemas. That is the first thing you should consider when experiencing all these symptoms. Now, these enemas can be added 2 hours apart of each enema, and these will be additional from the ones that you have already prescribed from the doctor into your protocol. And it's always important that once you increase your enemas to help with these reactions, you also increase your juices. If you feel that these symptoms are occurring or the duration is longer than a day, definitely must increase your juices. We don't want you to deplenish your body from electrolytes and minerals that could happen when you have an excess dose of enema. Now, again, it will be extra enemas, keeping them every 1 or 2 hours in a period of 24 hours. If this goes beyond that, we have to increase juices. Now, another thing that is important is that in those 24 hours that you're exceeding your enemas, it's important not to do more than 9. Your body can experience different reactions by doing too much of the enema. And this could be irritation, it could be also lack of sleep because you're exceeding your caffeine intake, and a little bit of heart race. So for this case, this will be the first line of defense and the only line of defense for these symptoms that I mentioned before. Now we're going to talk about the second reaction, which is the detoxification reaction. Now, this comes, of course, after doing any detoxification at all. But especially with our therapy, the Gerson therapy, where we try to stimulate the liver's ability of detoxification, we also stimulate these symptoms. Now, the symptoms can be more related to the discharge of mucus. If you're still having your menstrual cycle, it can be a heavier menstrual cycle. It could be also sinus discharge. And also, we can have rash in our skin, red spots in our skin. This is normal because our liver, which is the main route of discharge or detoxification of our body, it's trying to pull out the toxins quicker or heavier if a patient has been experienced before chemotherapy or radiation. So what are the things that we can do when a patient is experiencing all these reactions? Well, first, we could do a castor oil pack. A castor oil pack, the castor oil on its own has the property of pulling out toxins. So by applying a castor oil pack directly in the organ that you feel, especially the liver mainly, you will be helping or facilitating the discharge of the detoxification. We will show you in future videos how to prepare a castor oil pack and give you all the details of how long a session should be applied for and how often. Another thing that we can do is apply another castor oil pack for your sinus or chest area if you feel that you're discharging a lot of mucus. This will help you eliminate from the wall where the mucus is sitting in Harvin, and it will help you expel easier the discharge. Another thing is you have to hydrate yourself, not only from the juices, but also from teas. Herbal teas are highly recommended, especially chamomile and peppermint tea during these reactions. And also we have a special tea in our protocol that is a medicinal tea, a combination of 3 main medicinal teas that we will show you in our future videos, the different teas, how to prepare them, and how they can help benefit your body during these detoxification process. During this detoxification reaction, we can also experience trouble with our enema because inflammation may occur. When that happens, there's things that you can check on your enema when you're having the difficulty. First of all, you have to check the temperature. The temperature of the enema has to be at body temperature always. The second thing that you need to check is the height of your bucket. It has to be about 18 inches above your hip, and also the speed that the enema is going into your body. Once you check all these points and you verify that they're on top, on set, you shouldn't have any issue with your enema. But there's sometimes inflammation happening because of the discharge of mucus and the detoxification. So another thing that you can help to alleviate and make your enema easier is you may add a 1/4 teaspoon of potassium powder, or between 1/8 or 1/4, depending the intensity of the inflammation. This will help control the spasms of the enema and will help you have a more pleasant enema. But before doing this, it's important that you check all the other settings first. You do have to be careful of how long do you administrate this. It can only be done, the additional adding of the potassium into the enema every 4 hours, and it cannot exceed 24 hours of enemas. So be very careful. Check with your Gerson practitioner before you do this. Come back to us, email us if you have any questions before administering something like this on your own. But it's always good to know that we have plenty of options when we're having all these reactions, and especially when the enema it's becoming difficult. Another thing that we will need to apply maybe is we can have a little bit of inflammation in the rectal area with hemorrhoids, and it's natural. It's part of the detoxification. There's in the market plenty of numbing creams for hemorrhoids, and just make sure that you check the ingredients, and if you have questions on them, please feel free to email us, and we will gladly recommend other brands that are very natural and safe to use. Also, suppositories can be recommended. If you have access to chamomile creams, natural chamomile creams, these are allowed during this type of inflammation. Another difficulty that we can experience or symptom is diarrhea. Because the detoxification reaction is related to the gastrointestinal tract, we are always most likely to experience diarrhea. Now, it's natural. There's things that we can do to alleviate the diarrhea symptom. And first of all, we have activated charcoal pills that are very safe to take. Please check with your Gerson practitioner or email us to know the dosage and the frequency of the charcoal tablets. The second thing to do is we can apply again the potassium powder, 1/8 of a teaspoon, and we will also recommend how many hours. Basically, we can apply this every 4, but make sure you check with us before doing it. This will help control the spasms that you get when you have diarrhea and also release the pain. Another thing that you can apply is the chamomile enemas. In past videos, you've seen us prepare chamomile enemas. It's basically the same recipe as the coffee enemas, but if you have more questions, email us. And the chamomile has a property of alleviating any type of inflammation. So if you have to replace your coffee enemas with chamomile enemas just for the day, this is also allowed. And finally, if the diarrhea is very constant and it's just something that you cannot tolerate, our medical director recommends to stop the enemas for the day, for 24 hours. And the next day, we evaluate if the patient can restart their schedule or if they still have to keep the enemas in 0. Now, it's important that with all these reactions, you do come to us. You do explain everything that you're feeling, because it's different symptoms and they can be presented by different factors, and all of those have to be evaluated. So again, I keep insisting on communicate with us, and we will gladly assist you on this situation. Now finally, we have the healing of inflammations. This will occur basically because you are pushing your body to detoxify. We want that because that will increase the ability of your body to heal. And the other factor is that tumor cells or cancer cells, have this defense mechanism when they're being exposed to an oxygenated environment, to the creation of energy. They promote or they start producing inflammation around the area where they are kept. So what can we do? Our medical director, our doctors will prescribe sometimes some anti-inflammatories taken orally, some that are very safe to take. Others, in extreme cases, very extreme cases, will go to other prescribed medications. But when you're experiencing inflammation, inflammatory pain, we do want you to come back to us. We cannot recommend something in this situation because we need to make sure that we detect the type of inflammation reaction. Where is it coming from? How constant it is, and the level of pain that you're experiencing, so that our doctor may know how to approach this type of inflammation. Now, again, these all of these symptoms have to happen. It's important they do, because this means that our body is starting to recuperate the natural ability of healing. I don't want you to feel discouraged when you experience these symptoms. That's why it's always recommended that you come back to us and explain. Try to keep a diary at all times so that you can write down when the symptom happens, how frequent it does, how long it lasts. This way we're able to identify if it's a healing reaction or if it's something different. I don't want you to get discouraged, because sometimes the mind can play different tricks, and some of you may feel that the therapy is not working, or that you're getting worse. Now, this is natural to happen, and everybody will experience it, maybe a 3-month mark, 6 months, or 9 months, and it depends on your metabolism. So with this video, I hope that you can understand or identify the different symptoms and what are the tools that you can apply. And finally, there is another tool that is a complex formula of 3 supplements, and you can apply this. It's called the pain triad. The pain triad can be applied for pains that are muscular, inflammatory pain for the healing of inflammations, and migraines. This is a combination of niacin, vitamin C, and aspirin. Vitamin C, it's about 500 milligrams. Niacin is a 50 to 100 milligrams. And an aspirin can be 1 or 2 tablets. Now, it's important that when you're ready to prepare this medication to take, that you're not in your period. Niacin has the ability of expanding the capillaries and increasing blood flow. So if you're experiencing your period at that moment, it might not be pleasant to take this medication. You do have to wait and use the other natural treatments that we just mentioned before. And this medication can be taken every 4 or every 6 hours, depends on the intensity. You will learn how often or how sudden, quick you have to apply this. This is something that comes based from experience, that you will come to learn throughout the therapy. So basically this is it. This is our recommendations for the healing reactions, and I hope this was helpful for you. And if you have any more questions, please, again, during the whole class we've been saying this, come back to us, email us. It's very easy to get communication with us, so we can help you and assist you and have a plan of what you're going to do if the reaction increases or is too difficult for you to handle. Okay? Thank you very much.